Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Millicent Rovelo, and I'm here with my all-time favorite co-host, Dr. J. Calvert. How are you?
I'm good, and I'm happy to be your all-time favorite. I want to note that I'm your only co-host.
Well, we don't have to get into the details.
I don't know that I could also be your least favorite.
How about you just take what you get
and
you don't get upset. And we're going to call you my all-time favorite, okay?
I am happy to be your all-time favorite.
Thank you. Thank you. All gratitude. Thank you. So today we are playing the game of surprise.
I'm ready. Because I think it's fun, and because again, back to the whole thing, we don't have scripts.
We don't have scripts.
We have an amazing producer.
Yes,
Sean.
And
he's incredible. He's our guy.
We have a team, and then we just have the fact that we do these surgeries all the time. So we can literally pull a topic out of the hat and talk about it, which is usually how we do these podcasts. And so because I could not make up my mind, I was having a Millicent maybe day, we decided to play surprise podcast topics.
A Millicent Maybe Day.
Oh, that was a book from when I was a little kid. It was about this alligator who couldn't make any decisions. And so sometimes she'd wear this and she would wear that. And she'd wear 10 hats and carry 8 purses and wear 5 shoes because she was Millicent Maybe.
That's kind of you anyway. That's so funny.
I know.
That's a perfect book for you.
It was one of my favorites.
Got it.
So anyways, that was me today. And so we've been surprising each other with podcasts. And so it is my turn now to surprise you with the topic of tonight, because I know you're going to love it. It is the liquid facelift.
That is a topic that comes up a little too frequently.
A little bit too much. And, because you have your no filter facelift and we love talking about facelifts. We have like a jabillion facelift topics, but we don't have a liquid facelift podcast. And it makes one go, I wonder why. Why don't we? So what is it? You tell me, what is a liquid facelift?
So the first time I heard that term was from it was an aesthetic doctor, and a former anesthesiologist who had opened a medi-spa in Manhattan Beach. And she came in to me to get her facelift fixed. She'd had an actual facelift, and her face was about this wide and was all round, and she looked kind of like a lion. And she said, well, I'd been doing liquid facelifts for so long that I just finally bit the bullet and had, so-and-so do a facelift for me. And I was like, okay. But there was so much filler in her face that the facelift didn't help. And I think.
And so what is it? What is a liquid facelift?
It's just pumping filler into the face and there are so many descriptions of this thing because there's I'll put filler back here and that'll give you, this lift, and I'll put it in here and that'll give this lift. And all it is volumizing aspects of the face.
Just volume.
Which I don't think actually lift. I know we're going to get, there's going to be arrows coming through that door at us for saying these things, but it doesn't do lifting. It volumizes. It makes things bigger. It fills them.
Hence why it's filler. But
it doesn't lift. It doesn't.
It doesn't. Well, it does what filler does.
Takes up space.
Which, if you're using filler to rejuvenate the face, there are uses for filler for aesthetic contouring, creating cheekbones. Someone that may not have great cheekbones or enhancing lips. These are sort of like aesthetic enhancing uses of filler. But if you're using filler for rejuvenation, to reverse or to camouflage changes of aging, that's literally all you're doing. You're camouflaging. Because what's happening with aging is the skin and the soft tissues of the face are starting to descend. They're starting to fall off of the bony structures. And so a facelift, a surgical facelift, picks those structures up, lifts them back into where they originated and are supposed to be, and sutures them into position. Fillers mimic that look by filling in the areas that are now hollow, but it isn't actually lifting anything. Although if you listen to some of the instructors and some of the companies that make the fillers, they will tell you, if you put a little filler on the cheekbones, it's going to lift the skin back up into place magically, and it's like you had a facelift. So as you can see, there's a little bit of incredulity and disdain for that thought. Not to say that fillers don't have a place in the anti-aging
do.
world, because they absolutely do. But we'll talk about it. We'll talk about how they are best used judiciously. But the idea of a liquid facelift is that you were actually trying to recreate what a facelift can or could do by using fillers alone.
Yeah. And there's a lot of like Stay Puft Marshmallow Man look that you get out of this.
Right.
And it makes people's heads bigger.
Well, okay, so do you know, okay, maybe you can estimate for me, what is the average amount of syringes, 1cc syringes, that are required for a liquid facelift? So I kind of have an idea of a number.
I will tell you what I've heard, because I don't do this to people. I hear 8 syringes of Voluma. I hear 10 syringes of Voluma. I hear, and again, no, it doesn't have to be Voluma. It could be anything. It could be Restylane, Radius, you name it. Sculptra is a different animal altogether. We can talk about that separately. But the volume that they put in for these liquid facelifts is disconcerting.
A ton. Yeah, those are the numbers I've heard too. 3 of Voluma, like 1 on each, or 6 of Voluma, 3 on one side, 3 on the other cheek, and then 4 of Juvederm, and then 2 of the Restylane in the temples, and then some more in the chin, and then the number is incredible. So we're talking about huge amounts of filler, of fluff being pumped into your face. Yes, they are theoretically mimicking the hyaluronic in your body, but they're not. These are cross-linked structures. They've been manipulated. They're not exactly natural. And you're putting a ton of this in your face. So not only do you have a ton of kind of foreign bodies in your face, you have a higher risk, I would think, of filler complications, because anytime you're putting that much volume in the face, you have a much higher risk of getting intra-arterial injections, bruising, filler malposition, all kinds of things, because you're starting to, as you're injecting all these volumes, your face is getting puffy, you're losing your landmarks. It just can't be super safe. And you, I would say, look quite strange, because as you said, you're getting to look more like a marshmallow, and that's not what people want. They want to be a rejuvenated, more lifted version of themselves, not a big, fat, puffy marshmallow. And then lastly, it's expensive. Now, if money is of no object, then it doesn't really matter. But if what you're trying to do is save money because maybe you can't afford a facelift, then you just put $20,000 worth of products in your face that you are then going to have to repeat every 2 to 3 years. Like, I'm not sure how you saved yourself any money.
No, Dan Baker presented a paper at ASPS one year. Or no, it might have been at the aesthetic meeting, where he showed the cost of his average cost of his patients who were coming to his Medi Spa on a regular basis. He picked like some 50 patients, and they were spending, this was a while ago. This might have been 15 years ago. And he said they were spending something like $6,000 a year on the Medi Spa, between fillers, Botox, et cetera. And it's probably more today.
Right.
And the results were like temporary, like over and over again. And they would do that, 5, 6, 7 years, and then they'd bite the bullet and get a facelift. And his facelift at the time was something like $35,000 or something, which was very expensive at the time. Probably on the equivalent today of a $100,000 facelift.
But I think there's a role for those smaller amounts.
Yeah, there is.
Filler.
No, he said that. He says you need it.
Yeah.
He goes, but bang for your buck, the facelift is where the action
Bang
is.
for your buck.
Bang for your buck.
Yeah.
But he goes, because then after they got their facelift, they continued to spend the money to buff their result.
Right.
Which is why, again, it comes down to getting the right plastic surgeon who has the right temperament for you, who has the right aesthetic eye, who's going to guide you on your aesthetic journey rather than, just make you look strange the entire way. Because I can tell you that one of my friends, one time I was at a meeting in Stockholm about to speak, and my friend who I hadn't seen in a while came up to me, and I did one of these. Ah! I did. And it was like in the Just Go With It when they, when Adam Sandler and what's his name go up to Kevin Nealon's character and and Nick Swardson. And Nick goes like, I didn't know this was a costume party. And Adam Sandler looks and goes, are you serious right now? And he's like, oh, he doesn't want to put his fingers in the pie, and he can't laugh and water's pouring out. Like, it was like that. And I had that moment where I just was shocked at how big his head had gotten.
Oh, wow.
It was just massive. And I was like, oh my God, you gotta stop. You gotta get off the fillers, man. You look bizarre. And so this liquid facelift thing, to me, it's like, that's why I keep saying, like, Dr. Rovelo will be doing my facelift next summer. Like, I'm ready for it, because I'm not going to go down that road. I haven't had fillers pumped into my face. I'm not going to. I'm definitely of the age where that starts happening. It probably starts happening 10 years before this age, but I think you have to try to, temper it. If you are going to use fillers, great. It is okay, but you have to be judicious. You have to understand what the results can be. And those liquid facelifts, to me, just, and then when I go in to do their facelifts, there's just like filler, like
everywhere,
oozing out of the SMAS and oozing out of the soft tissues. And it's like,
the question,
is this good?
If you have someone that has had a lot of filler, do you dissolve it before your facelift?
You can try. It doesn't work. I do that. I'm not sure it's worth it. I think you just suction out what you can suction out when you're in there, because it's like, it's all through the soft tissues. It's in the SMAS. It's
very diffuse.
It's not, because it travels. Like, people think, oh, I put it in here and it's going to stay. It does not stay there. It goes all through your face.
It totally travels. Yeah.
Yeah. I just, I like fillers, and I like lips. I like some, a little bit of, volume
cheeks,
on the zygoma, like a little, like not like this, like, hey, I'm going to reconstruct your face with ooze
product. Yeah, and it's I think that's where you have to know what practitioner you're going to, and who's going to give you the look you like. And the best way to figure that out is to look at the practitioner themselves, because that's probably
100%.
what you're going to look like.
Because they're doing it to themselves, baby. You know that. Yeah.
So that's actually, like, look at the office staff. Look at the person. Like, is that the look you want? And if it is, fantastic. You're in the right place. But I think for people that are starting to use filler for anti-aging purposes, there is a place for it. Not everyone's ready for a facelift, either financially or even age-wise. And there are some things that you can do before you do bite the bullet to sort of improve the overall aesthetic. So if you're in your late 30s, 40s, even the 50s, there are some small, like, filler sprinkles that you can do to sort of camouflage some nasolabial folds, some cheek volume loss, some chin filler. These are all things that you can definitely do, and they do make a difference. They do make you look better. But I think if you have the knowledge and you understand that you are not achieving a facelift, you're just holding it off a little bit longer, or you're doing kind of a mini result until you get to that facelift time. Because if you are actually trying to achieve what a facelift achieves with filler, you are going to spend a lot of money, you're going to increase risk of complications, and you're going to look very, very strange. And there was this term going around, I can't remember the term now, because I didn't entirely understand it at the time, but it was like something about when you dissolve your filler in your face, there's like a certain look people say they get, like a filler, it's not filler face, but it's like something where your whole face just deflates and now you look even older than you used to be. I never really understood that, because I was like, how much filler do you have to put in your face for your skin to stretch that much? But I think some people actually are. They're putting so much filler in their face that then when it gets removed, they literally look deflated.
Yeah.
So if that's happening, then you're putting in a lot of filler.
Yeah, not good. Speaking of interesting topics that you see in the news, I did have a quote in the Daily Mail yesterday. Did you see that?
No, doctor, tell me.
I was called to ask about whether Donald Trump had these hair transplants or liposuction in the 80s or something like that, and said, can you comment, on whether or not he's had plastic surgery? So, of course, I looked at him and, went on Guts Local, some photos of him, and looked at his old photos, and I said, well, if he has had plastic surgery, he clearly needs more. He needs his neck done. He needs his eyelids done. He needs a good facelift. And I said, and by the way, he could look really good if he did all this stuff. Good.
Yeah, he does need it. If he had some, then it's been a while or was not great. I'm going to go with he probably hasn't had some in a very long time, if any.
Well, of course, the Daily Mail left out and if he did it, he'd look great. They didn't put that in there. They basically just had me like, slinging mud at him for not having good plastic surgery, which is really funny. So I was like, whatever. Maybe he'll call. I'm available after your trial. Come on in.
Dr. Calvert.
Dr. Calvert, I read your words in Daily Mail.
They made me very unhappy.
I have to say, you're fired. It was so funny because I was like, man, if he's had plastic surgery, like I'm a monkey's uncle.
Yeesh.
Like somebody did not help. So like, get him on the table. Like, get him in here. Let's go. Yeah, it's whatever. I'm sure that's the least of his worries right now.
Right now, yeah.
That's not the time.
That's funny
for him.
No liquid facelifts for him.
Can we just talk about Sculptra for 1 minute though? Because
let's talk about Sculptra.
I like Sculptra.
I do too. So
what do you like about it?
Okay, so let's just break down. I'm going to talk about 3 types of fillers that we have. The ones we kind of were alluding to just now, the HA fillers,
Mostly
hyaluronic acid. Bodies have hyaluronic acid. It's part of our soft tissue makeup. It kind of adds that plump baby's butt softness, juiciness to your tissues. And
it's a sugar protein combination.
And it holds water, and it's a nice.
It's good.
It's hyaluronic.
Big component of cartilage. It's in the soft tissues.
And we like it as a filler because it mimics that composition and because it's easily dissolvable. We have a compound called hyaluronidase, which you can inject, and it dissolves any filler that you've put in there that has HA in it. So it's a reversible filler. That's what we call it. And then you have something called Radiesse, which is like a calcium kind of filler.
Calcium hydroxyapatite.
So it's more chalky, a little bit more firm. I don't really use it that much. Some people really love it. It's not reversible, which is one of the reasons I don't love it.
Put it in, it's there.
It's not permanent. It goes away eventually. But if it's where you don't like it, you kind of just have to wait for it to dissolve because you can't dissolve it on your own. And then there is what you just referenced, which is Sculptra. Sculptra is a product that doesn't really bring any inherent volume with it. You dilute it with some saline before you inject it, so you get a temporary volumizing effect that lasts for a couple of hours, and then as the saline component dissolves, that goes away. But what it does, as the Sculptra starts to take effect and where it's being put, is it stimulates your body to create its own collagen so that over time you build volume in the area that you injected it, but you're building it naturally with your own collagen that then sticks around and lasts as your own collagen would.
Yeah, it makes soft tissue. I mean, it makes some collagenous extracellular matrix type of, it's not really scar, but it's tissue that's sort of, it has volume to it, and it works. And it works very well.
But it does take a little while, so this is not going to be an instantaneous effect.
It's a commitment.
It's a commitment. So you do it. Sometimes you have to do a couple rounds of it, but I like it because again, it's your own body creating the volume.
Yeah, and it's a one thing that you can really use for like if you don't have fat, other than buying allograft fat, which is very expensive. You can use Sculptra for the butt, and it does make some soft tissue. I've done some pretty good butts with it.
Yeah. The problem is it's expensive. It's going to take a lot of vials to fill up a butt. Sculptra was initially used actually way back in the day for HIV patients. So patients that had a lot of facial wasting, their faces got very thin. Insurance would actually cover some of these injections. And so it worked because it would take these very thin, gaunt faces and over time give them back a little bit more volume. So it's been around for a while. It has a relatively good safety profile. It has a few complications with it. You can get these little kind of firm granuloma type ball things that are not fun, but they happen sometimes. But overall, it's a fairly safe product and pretty reliable.
Yeah, I mean, I like it. I think, Sculptra is it's worth the go. You do have to be patient because it takes time to grow the tissue. It doesn't happen overnight. But it stays when it's there. That's kind of it. Yeah. It's done. It's a done deal.
Yeah.
Especially for like mid-face, for, I do it in the temples. Like I'll use it sort of all over the face as necessary. I use it for the buttocks. Some liposuction dents or defects. It's good there too. But yeah, I think that's something worth knowing about. If you're in the liquid facelift shopping category, think about Sculptra.
Yeah,
I
actually would really agree with that because it's not going to give you that overfilled look because your body just doesn't do that. Your body naturally is not going to overproduce tons of stuff. Like it has its own breaks, which I think is good.
Yeah, the filler face is just, you can see it from like across the room. You're just like,
Ooh.
It's, okay.
a
Well,
look.
that's what you want.
It's a look.
Yeah, it's a look. I mean, it's just like the mantis lift, though. I mean, people want that.
People want
They
it.
want to look like a mantis, and I don't do that. I'm not going to do that. You can't request the mantis lift here. I can only do like that really natural, no filter facelift thing. It's kind of the way that it's got to be.
All right. So no liquid facelifts here. Sorry, folks.
No, but we'll be happy to treat them when they hit the
When they hit the
when the
wall.
wheels come off. We're here for you.
Absolutely. Well, is there anything else you'd like to add to that, Doctor?
No, I'd like to not add.
Not
any
add.
more
We'd like to
filler.
subtract a lot.
I'd like to
A
add some
lot.
hyaluronidase and call it a day.
All right. Well, in that case, this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.